Hello, my name's Professor Peter Jones and I'm the lead author for our article TB or Not TB, the question regarding TB treatment in the remote provincial hospital in Solomon Islands. This research was carried out in 2017 and highlights the fact that there continues to be an active TB epidemic right across the rural areas of Solomon Islands. There's really very little accurate data about what's really happening in the remote provinces with tuberculosis. They do a really good job of making sure that those that they think have the disease receive the initial intensification phase of treatment for tuberculosis, but it's very hard to do any follow-up or outpatient medical work in the community. I think what we really need to do when we see research like this as a community like Australia with a lot of wealth and resources is to look and see what we would need to do to get on top of the TB epidemic that's still occurring in the Pacific. If we don't, there's no doubt at some stage in the future that some of these patients will travel to Australia and there will be problems with tuberculosis in Australia as we see them as it's occurring in the Solomon Islands. These countries are on our doorstep and in so many ways are the responsibility of Australia and the broader Australian community. It really is in our interest that the health care of the peoples of the Pacifics is looked after, and when you read this particular paper, I hope it does raise more questions than answers, because it describes the great challenge that faces those nurses and handful of doctors that have to work in these remote provinces and just don't have access to some of the diagnostic tests and investigations we probably take for granted in Australia. It's interesting to note that there would be logarithmically more resources devoted to tuberculosis care in Australia for so many fewer patients. I hope you enjoy reading the study and look forward to any of you deciding to make some comments about the paper.